Hello, I'm Jocelyn Johnson, an 8th semester nursing student. Today's date is January 31st, 2018. Today's time is about 4 o'clock p.m. So I will be demonstrating how to do a full head-to-toe assessment. So before I go into my patient's room, I have washed my hands. So now I'm going to go in my patient's room. Knock, knock.
Hi.
Hello, I'm going to provide patient privacy, and I'm going to introduce myself to the patient. I'm Jocelyn. I'll be your nurse today. Can you tell me your first, last name, and your date of birth?
Last name Nana Mwako, September 28th, 1990.
Okay, awesome. Okay, thank you. So what I'm going to be doing is just a head-to-toe assessment. So in the beginning, I'm just going to ask you a few questions, okay?
Okay.
Can you tell me where you're at today?
I'm in the hospital now.
Okay, do you know what today's date is?
Today is 31st January,
Okay,
2018.
awesome. Do you, can you tell me what brought you into the hospital today?
I've been feeling dizzy, so I didn't know why, and I was like, let me come and check in.
Okay, okay. Do you have a significant past medical history that you need to disclose or anything?
No, nothing.
Okay, do you have any allergies that you know of?
No, I'm not allergic to anything.
Okay, I'm just going to raise the bed to a working height. And whenever I first walked in the patient's room, I'm already assessing. I'm assessing if they have an IV, any drains, dressings, wounds, any of that nature. And then if they did, I would further assess those things. So first, I'm just going to do an overall look at the patient. He looks clean. I've talked to him, so I know his speech is intact. So now I'm just going to look at him. I'm looking for symmetry of the face. The ears are symmetrical, the eyes are symmetrical. His nose doesn't look deviated. Everything looks good in that. There's no drainage from the ears. Now, if you'll just open your mouth for me. Teeth are intact. Membranes are moist. Okay, I'll take this back out. Now I'm going to basically check your eyes, okay? And I'm going to shine a light in your eyes. So you can just look straight ahead if you'd like. His eyes were equal and reactive to light and round. Okay, so now after I've done that, I'm going to go ahead and work my way down. So I am feeling the patient's skin. His skin is warm. It's not dry, it's moist. Now I'm going to check his pulses. They are equally bilateral. I'm going to check skin turgor. Less than 3, awesome. I'm checking his fingers for any clubbing. I don't see any clubbing. Now I'm going to check cap refill. Perfect. Now if you could just grab my, thank you. He has equal grip strengths bilaterally. So now I'm going to go ahead and I'm going to listen to heart sounds and lung sounds. So first I'm going to listen to heart sounds. And in the clinical setting, I would actually do this on skin. Awesome. And I would also flip the stethoscope over and listen with the bell of my stethoscope. So now I'm going to go ahead and listen to lung sounds. Now I'm going to ask my patient if they could sit up. If they had problems sitting up, I would work around that. Thank you. Now I'm going to assess the lung sounds laterally and posteriorly. Okay, lung sounds are clear in all lobes, and at this point I would see if he had an incentive spirometer at the bedside. If not, I would go get one and teach the patient how to use it. You can go ahead and lay back down for me. So now I'm going to work my way down to the abdomen. First, I'm just going to inspect the abdomen for any bulges or anything in that nature. And then I'm going to go ahead and ask my patient, when was the last time you've had a bowel movement?
This morning.
Okay, and are you passing gas?
Yeah.
Okay, so now I'm going to go ahead and listen or auscultate in all 4 quadrants. Okay, awesome. So his bowel sounds are active in all quadrants, and now I'm going to palpate. But before I palpate, I'll ask the patient if they have any pain or tenderness in your abdomen region.
No.
Okay. So as I'm palpating, I'm looking at the patient's face for any grimacing. Are you doing okay? Okay, awesome. So now I'm gonna work my way down to his lower extremities. Now with his lower extremities, I'm assessing for any edema and any bruises or anything of that nature. So it looks good. Could you push down towards me? Good. Pull up. Okay. Good strength. I'm checking for pedal pulses and post-tib pulses. Awesome. Okay. So now I'm going to have you sit up and swing over this way because I'm going to check your reflexes, okay? So just, yeah, relax. Oh. Good, his reflexes are intact. So now after that, I will wash my hands, I will document my findings, and I've also checked vital signs already, and all of those are within normal limits. So after I've washed my hands, I would provide safety to the patient by lowering the bed and making sure the call light is in reach, and asking if the patient had any questions. Thank you.